Good morning, everyone, and good evening in Europe and India. Pcos affects approximately 5 million women in the US alone. 1 in every 10 women in India has Pcos. We are going to showcase the efficacy of Ayurveda for Pcos with a real user who will narrate her success story today. Presenting this session, we have Vaidya Rahul Gupta, a senior Ayurvedic physician with MD in Ayurveda. Vaidya Gupta has published a lot of research and presented his research at international conferences. Joining him today will be one of our clients who, like I said earlier, she will share her success story at the end of the session. I am Amita from Nourish Doc, a global platform for natural and holistic therapies. I would like to introduce all of you to Vaidya Rahul Gupta. Welcome, Vaidya Rahul.
Thank you, Amita. It's been a pleasure for me to present my second topic, that is PCOS today.
Okay. Would you like to get started with a simple introduction?
Yeah. PCOS actually means polycystic ovarian syndrome. Sometimes it is also called as PCOD, that is polycystic ovarian disease. Actually, it is a common hormonal disorder affecting about 10% of women of reproductive age, and PCOS is a major cause of infertility. Next, please. Now, there are two diagnostic features of PCOS. If a person is suffering from a PCOS, she must have these two signs out of the three. First one is irregular menses. Second one is excess of male hormone, that is androgen. It can be diagnosed either by the lab investigations or by the signs, that is excess facial hairs, body hairs, severe acne, baldness, etc. And the third most sign is a diagnostic test, that is ultrasonography, where the PCOS appear as multiple fruit-filled cysts in the ovaries. You can see the picture in the bottom of the slide. Now we move on to the symptoms of PCOS. The basic symptom of PCOS is irregular menses. If a female has a menstrual cycle of more than 35 days or less than 9 menses a year, then she might be suffering from PCOS. Second symptom she faces, that is heavy bleeding. Third is excessive hair growth. The hair growth is the male pattern hair growth. It is also known as hirsutism in the medical language. Next symptom is acne, weight gain, male pattern baldness, darkening of the skin, and sometimes patient also feels like headache. Next, please. Actually, according to the modern science, there is no fixed theory or proof that the PCOS is caused by this and that. There are some supposed theories that suggest the patient is suffering from PCOS. The first supposed theory is that the disturbance of hormone level in a female patient, the patient might experience excessive luteinizing hormone. Second one is the low follicle stimulating hormone. The follicle stimulating hormone is secreted by the pituitary. And the third one is increased level of insulin. Due to these hormones, what happens when there is excessive LH or luteinizing hormone in the body and increased level of insulin, it promotes the overproduction of androgens, that is male hormones in a female body. Next, PCOD, the second thing that matters most is heredity. So if you have someone that is suffering from PCOS, then you might have a chance that you also be getting the same disease in the next generation too. Next, please. As said, the PCOS affects the pregnancy also. It interrupts the normal menstrual cycle and make it harder to get pregnant. Between 70 to 80% of women with PCOS, they face fertility problems, and if they conceive, the PCOS can also lead to miscarriage or premature birth. Next, please. Now we move on to the common medical treatments available in the modern science. Actually, when the patient has no need of pregnancy, then the doctor tries to regularize her menses by giving birth control pills, which is again a hormonal treatment. Uh, Diabetes is one of the complications of PCOS, so sometimes anti-diabetic treatment is prescribed to the patient. If the patient is looking for the pregnancy or fertility, certain medications like clomiphene, etc. are prescribed. The action of these drugs is to induce ovulation during a menses. And cosmetic treatments for hair removal, the medicines are used. Some patients use laser treatment also. And next one is the surgical treatment for PCOS. Actually, modern science also go for surgical treatment, that is ovarial drilling of the PCOS, but it is not a good thing to do. Let me explain you why. Actually, when the female fetus is in the womb of her mother, both ovaries has actually 6 lakh ovums on the both sides. The 3 lakh on the one side and 3 lakh on the other side. And once the baby is delivered, the number of that follicles, ovarian follicles, decrease to 3 lakhs. That is 1.5 lakhs on both the sides. And when the female matures and reaches its puberty level, that is the onset of menarche, the number of these ovarian follicles reduced to 300. That is 150 on one side and 150 on other side. So you can see that how the ovarian follicles number decrease by the progressive age. So in drilling, that is surgical treatment, what happens that the surface area of the ovary is ruptured by the machine, which sometimes affects the internal medulla of the ovary, and thus can damage the whole ovary and can disturb the whole follicles of that ovary. So it can make your chances worse of getting pregnant. So no need to go for surgical treatment in PCOS. The other complications that are associated with PCOS are ovarian damage, that as I have already mentioned. Uterine adhesions. It is a thing that means that the ovum, the ovary or the uterine get attached to the walls. Third is peritonitis, and sometimes patient also feel hemorrhage, that is excessive bleeding after the surgical treatment. Next, please. Now we move on to the common complications of PCOS. The first and foremost complication is infertility. It is a number one positive factor of infertility. PCOS also can cause type 2 diabetes. It can also cause to obesity, and due to metabolic changes, it can also cause cardiovascular diseases. PCOS is also related to brain functions, so it can also cause mood disorder or depression in the patient. If the condition complicates, or sometimes the patient also suffer from endometrial cancer, and there are few cases in which patient also suffer from breast cancer due to PCOS. So it is a very dangerous thing. So if the patient ignores, or if the patient is not properly treated, it can cause life-threatening issues.
So let's talk about the Ayurveda perspectives now that you've covered overall complications, symptoms, and causes.
Actually, some people have a query that the PCOS is a modern thing, and how it is mentioned in Ayurveda. Actually, Ayurveda Siddhant or postulate depends upon the Panchabhautik Siddhant. That means that whatever it is in nature, it is in our body also. It also means that our body is derived from a nature. So anything that comes in the upcoming days, or any disease, any new disease if comes, it can be put forward into the Panch Mahabhat Siddhant. So nothing goes apart from the Siddhant. So we can treat PCOS according to this Siddhant. Regarding the ovary, ovary is also mentioned in our ancient text. It is mentioned as Antah Phal or Phal Kosh. Since the physical issue or ailment of a patient, female patient, is very important, its answer comes from its menstrual system. That means that the menstrual system of a female cannot be ignored in any condition whatsoever. If it's related to reproductive system, that is fine. If not, then also the menstrual system cannot be ignored in any female. Now we move on to the causative factors of PCOS. PCOS occurs due to vitation of all the three doshas, that is Vata, Pitta, and Kapha. First, we will see Vata Dosha. Vata Dosha is mentioned that every gynecological disorder in Ayurveda is mentioned that it is basically due to Vata Dosha. Vata Dosha in a body is a dosha which provides movement to the body. And since in PCOS, the ovum matures and movement happens, so vitiation of that Vata Dosha affects the motility of the ovum. So Vata Dosha is involved in PCOS. Second is one is Pitta Dosha. Pitta Dosha is a Ushna Dosha in Ayurveda. That means that it has a heating capacity or heating tendency. So the optimum temperature required to mature the ovarian follicles is dependent upon the Pitta Dosha. You can see that after when the bird gives eggs, then she needs to hatch that eggs so that the progeny comes out of the egg. So in the body also, a female body needs an optimum body temperature, which leads to the maturation of the immature ovarian follicle, and then it leads to the ovulation. That optimum body temperature is governed by Pitta Dosha, and it comes from the normal Rakta Dhatu or normal blood from the body. Third one is Kapha Dosha. Kapha Dosha is a mucilaginous dosha of the body, and in Ayurveda it is said that Shleshma Vata Bhyam Granthi Sannivam. It means that when Vata Dosha mentioned in the above and Kapha Dosha mixed together, it forms any abnormality like cyst, any tumor, any fibroid in the body. So it is due to Vata Dosha and Kapha Dosha. Next, please.
Okay. So maybe you could say for a lot of people who don't understand the Panch Mahabhuta, like what are the 5 elements? We can just tell, I think people might not know what 5 elements are.
Okay. The 5 elements, it means that our Mother Nature is made up of that 5 elements. First one is Prithvi or earth. Second one is Jal or water. Third one is Agni or fire. And fourth one is Vayu or air. And fifth one is Akash, that is sky. So everything in this nature is the combination of these 5 basic elements, and every disease or even our body is made up of these 5 elements only. So we have to synchronize these 5 elements according to the disease so that we can treat our patients. Okay. Now we move on to the causes and pathogenesis of PCOS. Actually, the basic reason for PCOS is being the misconduct during the menstrual period. If a female does not follow a menstrual regime, then she might develop or she can develop PCOS in the near future. It involves intake of excessive sour, spicy, and salty diet. And this I'm talking about the bleeding phase of the menses. If she intake this diet, or if she goes on to the excessive physical activity. Now in India, what we can see that the sanitary napkin advertisements, the people show that the girl can do everything in this menstrual period, even jumping. I have shown the pic of that in the slide also, and it is not ethical, or it is not good for a female to promote these kind of things. Since the uterus is wounded, somehow wounded, because bleeding is going on, so the female has to take rest. But opposite to that, the advertisements promote these kind of activities, so it is very harmful for the patient. Next one is the bathing. Actually, what happens that if the patient bathing is contraindicated in menstrual periods, but it does not mean that you don't have to maintain your hygiene. Bathing can cause pus formation in the uterus, which can then lead to the PCOS. Sexual indulgence is also one of the cause if it is done on the menstrual period. Irregular sleep timings also contribute to PCOS, and some of the patients which have painful menses, they tend to use painkillers every menses. So use of painkillers in menstrual period also lead to the PCOS. It can also complicate the condition to endometriosis. It is a much more dangerous condition. So use of painkillers is one of the key factor also. Now we can move on to the pathogenesis, the structural or anatomical pathogenesis, what happens in PCOS. Actually, during the bleeding phase, the uterus is somehow wounded. So these factors, when the patient indulges in these kind of factors, the wounds secrete pus in the body, and then this pus formations or this pus then get reabsorbed in the body, and the toxins of this pus get reabsorbed in the blood. And what happens due to that, the body develops somehow feverish symptoms, and the patient thought that she is suffering from fever, and then she used antibiotics or antipyretics to reduce that fever, and which disturbs the overall ovarian rhythm. Next, please. Earlier I have discussed the structural pathogenesis. Now I'm discussing the physiological pathogenesis. Actually, in Ayurveda, that it is told that whatever we eat, it is converted into the ras dhatu. Ras dhatu is the first most conversion of the our diet, and that ras dhatu is responsible for the production of two things. First is the menses, and second one is the stanya, or that is the breast milk. So the basic grahani dushti, or if the digestive system or digestive engine is affected when the patient eats abnormal diet, it affects the ras dhatu, then it affects the artav, that is menstrual blood, and the menstrual blood, then it affects the system, that is the uterus and the ovaries. Second most factor behind the PCOS is the inheritance of male behavior. In Indian conditions, generally the first child, in some families, the first child is treated as the male child, because uh, they want a male child, but if the first child is born as a female child, they tend to treat her as a male child. This sometimes what happens that due to this behavior, there is a changes in hormones in the female body, and which leads to the excessive secretion of androgens, that is male hormone, and it can lead to the PCOS. The same pathology happens in the working women. Nowadays, we are seeing that not only in India, but in the other countries also. In terms of equality, females are inheriting male behaviors. It includes the work schedule, the dressing sense, etc. So it leads to the increased production of male hormones in the females unknowingly, and which can lead to the PCOS. Third factor is the use of MTPs or ECPs. MTPs is the medical termination of pregnancy, and the ECPs is the emergency contraceptive pills. So it is one of the factor. Some women also take medicines to delay their menses. In India, generally we see that women take these kind of medications due to some religious purpose. So it can cause PCOS in future also. Fourth and the last factor is a compromised mental health. Since the PCOS is or the body is complete sync with the mind, and in females the limbic system or emotional brain is very much active. That emotional brain affects the uterine and ovarian health, and it's also vice versa. The ovarian health sometimes affects the brain also.
So
Next,
you
please.
think so you think these are the reasons why it has increased in, you know, if you look at few years back, PCOS cases or people prevalence, I should say that, and now there are more women. So you would attribute all these factors to
Yeah,
increase?
yeah, the 100%. These are the key factors that cause PCOS. Actually, due to a detailed study in Ayurveda, we can rule out these kind of factors in our Ayurvedic text. But still, it is a query for modern science what causes PCOS. So, believe my word, these factors are very much responsible for PCOS.
Okay. Moving on. So let's talk about a little bit about the prevention and um, and how can Ayurveda help?
Okay. There are the simple, you have to follow a simple regime or a balanced lifestyle so you can avoid PCOS. Uh, as I have told earlier, that the misconducts of the menstrual period can cause PCOS. So you have to take a proper precaution to avoid such conditions. Actually, there is a set guidelines in Ayurveda to what to do and what not to do during a menstrual period. So if you are not aware with that do's and don'ts, you can just simply uh, have a non-monotonous diet. That is, you need to eat everything. Not only some women are like sour diet very much. Some women like salty diet very much. You have to eat all the six taste or rasas in your diet, and you can do sponging instead of bathing to maintain your hygiene. Complete rest is very much necessary if you want to avoid PCOS. If you are working, you can at least compensate that by taking casual leaves, or you can also do rotational job shifts if it is possible. But if you go against the nature, nothing will stop you from getting ill. So at least you can compensate that. Proper sleep is very much necessary during the menstrual periods. Sexual abstinence should be maintained, and do not consume any kind of medication during menses, not even Ayurvedic medication during menses, because uh, during a menstrual phase, the detoxification is going on. I will give you a few examples which you can see in India. During a menses, the menses is a process of detoxification of a female naturally every month. So not only the uterine area detoxifies, the uh, uh, every single part of the body, the toxins releases from the every single part of the female body. In India, you can see that if a menstrual female goes near the pickle, you can soon find a fungal in the pickle got disturbed due to the fungal. The pickle needs the fungal. If the female is wearing a gajra, it is told as the flower. If in Indian culture, the female used to wear gajra or flower in their hairs. So if in a normal female, the flower uh, uh, can be preserved up to 8 hours. But if the female is a menstrual female, the flower get decomposed within 45 minutes. So it's not only the menses, the whole body of the female is during the detoxification phase. Any of the factors that is mentioned above, if the patient does that, that toxins detoxification process is affected and the toxins get reabsorbed in the body, and hence the patient suffer from these kind of conditions. So patient must avoid these conditions. Second, the use of pranayama is also very effective in PCOS. Only 30 minutes of Kapal Bhati for 90 days can dissolve any kind of cyst and fibroid in the body if done properly. So Kapal Bhati, Brahmari Pranayam, it is very effective in PCOS. Third point is the female does not need to ignore his general health, because general health is interlinked with ovarian health. So if she ignores her general issues, it might lead to PCOS also. Next point is to improve the diet. As I told earlier, the better the food you intake, it will lead to a better ras dhatu, and better ras dhatu leads to a better menstrual blood, and better menstrual blood lead to the improvement of the health of the organ, associated organ, that is uterus and the ovaries. And the next one is the you can go for a Panchakarma schedule. Panchakarma is a Ayurvedic detoxification schedule. It can be done in a regular basis to stay healthy. So if you have a facility of a Panchakarma center nearby you, I would recommend you to go for a Panchakarma treatment every 6 months. And last but not the least, every mother should pass on this traditional or this Ayurvedic knowledge to her daughter, so that she may not suffer this kind of condition in her puberty age. Not only PCOS, any gynecological disorder can be removed if she follows these simple regime. So then only she can prevent. Next, we move on to the eco medicines, or what medicines are beneficial in PCOS. Actually, in Ayurveda, we have a very vast study of every ailment. And according to Ayurveda, no single medicine fits all the patient. So it goes for the PCOS also. We have a combination, symptom combination decides what medicine to give to the patient or what not. So you can try these. And the first medicine you can use for PCOS is aloe vera. It is shown on the second image of the screen. Can you move the cursor, please? Amita?
Sure. Yeah. Right here.
This one is aloe vera. If the patient is suffering from jaundice or typhoid fever, plus the patient is suffering from anemia or pandu, and if the patient is obese and she has PCOS, then aloe vera is a very good effective remedy for her. You can give 4 teaspoons leaf juice of aloe vera juice or aloe vera gel twice before meals. So it is a very effective medicine for PCOS, and it also supposed to remove any kind of disorder of a female between the onset of her menses and till marriage. Second one is asparagus. It is also known as shatavari in Hindi or in Sanskrit. The image is the first one, top one. Can you please move the cursor?
Yeah, we can see that, right?
This one is the asparagus. Asparagus is given to the PCOS patients which are generally skinny and has a dark circle around eyes, has a dark complexion, plus she is suffering from hirsutism, that is male pattern hairs, and hyper secretion of male hormones of androgenism, and she has a weak appetite, suffering from IBS, or she suffers from regular palpitations. Along with PCOS, you can give asparagus or shatavari. It is a very effective medicine. You have to give 1 teaspoon powder of the asparagus root. You can see the white color roots in the image. You have to use the roots for that. 1 teaspoon powder of the asparagus root with milk twice before milk, and it will be beneficial in PCOS patient. The third one is drumstick plant.
This one, right?
Yeah, this is a drumstick plant. The drumstick plant is used in the combination like if the patient is suffering from a joint disorder, or the patient is suffering from a uterine adhesions, or she is getting clots or muscular shreds in her menses along with dysmenorrhea, and she is suffering from PCOS, then drumstick plant is a very effective remedy for such kind of patients. You need to use the leaves of this plant, and 2 TSP leaf of this plant with honey is very good for PCOS patient. In fact, the drumstick plant is also very effective in the patient of uterine tuberculosis. The female patient is suffering from tuberculosis of the uterus. She can take this herbal remedy. Next one is sweet flag. The image is it in the, yeah, this one is sweet flag. The PCOS patient related with psychological disorders, the sweet flag is very good remedy. It is also known as vacha in Ayurveda. If the patient is suffering from mood swings, has irregular menses, suffering from seizures or hysteria, and also suffering from dementia, and patient has PCOS, then decoction of the root of sweet flag along with milk is very effective in that. And the sweet flag is very effective remedy for patients suffering from obesity and gynecological disorders after tubectomy operation. So if you are getting obese after tubectomy, you can use sweet flag. Next, please. Next one is the tamarind. Tamarind, it is also known as imli in Hindi. Actually, it is a very good remedy. Yes, the upper top one. When the patient is suffering from fibroid, patient has uncontrolled hunger, and due to that, patient is suffering from obesity along with PCOS. The tamarind is a very effective remedy for such kind of patient. The poultice prepared from the tamarind leaf must be applied on both sides of the belly button. Leaves also can be used internally as a salad too. You can also use this at your home if you have so many guests and your food is less, then you can serve tamarind in your salad also. It will reduce the appetite of your guest also. So you can try this at your home also. Next one is the wood apple. It is known as bale in Sanskrit and eagle marmalose in botanical language. If the patient is suffering from dysentery, or the patient is suffering from diabetes or any uterine abnormality along with PCOS, the leaf juice of wood apple can be used in such kind of patient. And next one is bonduk nut or fever nut. It's the, yeah, this one. It is also known as Lata Karanji Beej or Kuberaksh in Sanskrit. The patient, if the patient is suffering from constipation, if he has having sticky stools along with PCOS, the powder of seed cotyledon of this herbal medicine should be fried in cow's ghee and taken half TSP before meals. It is a very effective remedy in such patients which have non-ovulatory menstrual cycle. So it is very effective remedy. And next one is the giloy, or the last image in the bottom. Yeah, this one is giloy. It is also known as Tinspora cardifolia. Actually, some patients develop PCOS due to mumps. You have heard that mumps can cause testicular swelling in males, since the ovaries are the resemblance to the testes, and if you see a histology of the ovaries and testicles are the same. So when if the fever affects testicles in males, the fever can also affect the ovary in females also. So if the female has an episode of mumps in the past, if she is suffering from hyperacidity and if she is suffering from PCOD, then the extract of this plant can be used. It is a very beneficial plant. Next, please.
All right, so let's come to the Ayurveda treatment now.
Yeah, as discussed, I can say from this platform that PCOS can be completely cured within 3 to 5 months by Ayurveda treatment. Since Ayurveda is a holistic treatment, there are several benefits of Ayurvedic treatment over the modern treatment. First of all, is the Ayurvedic treatment is non-hormonal. It is a non-surgical treatment approach. It has zero side effects. And third one is that during the treatment of PCOS, the herbs also improve the general health of the patient. So it is a win-win situation if you go for the Ayurvedic treatment of PCOS. Since there is a wide range of medicines, because the treatment of a PCOS patient depend upon the original diagnosis of the patient. So there is a wide range of medication that we use in the PCOS patient. I'm showing some key medications on my slide. First one is a Kobirakshvati. It is a classical medicine. It is made up of that herb mentioned in the previous slide, that is bonduk nut or fever nut. So we can use Kobirakshvati. We also use Sukumar Grit or Falgrit in some patients. Pushpa Dhanva Ras also used. Dev Darwarish or Karpus Mulasav is also used. And Sanshamnivati is also used in PCOS patient. Next, please. Now we move on to the Panchakarma treatment. Since all the three doshas, that is Vata, Pitta, Kapha, is involved in the pathogenesis of PCOS, the Panchakarma treatment changes according to the doshas. If the patient has a PCOS due to Kapha Pradhan Dushti, Kapha Dosha, Vamana is performed. Vamana is actually a medicated MS. Medicated MSS. Second one is the Basti. Basti is a medicated enema. It can be done in a Vat Pradhan PCOS patient. Actually, Sacharadi Tel Basti is very effective in PCOS, such PCOS patients. We can also use the Uttar Basti. Uttar Basti, Haridra Tel Uttar Basti is beneficial in it. We have to give it in the intrauterine route. We can also go for a Virechan. Virechan is a medicated purgation. It is generally done for the cleansing purpose of the uterus. We can also do Rakt Mokshan, that is bloodletting. The site for bloodletting is above the mons pubis. Apart from these treatments, there are three important treatments which we follow in our Shri VISHVA Parampara. First one is Mutra Vireshni Chikitsa. Actually, left renal blood vessel, that is the blood vessel going to the kidney, moves around the ovaries. So according to this postulate, if we increase the urinary output of the patient, it can lead to the recovery in PCOS patient. Secondly, the Grahani Balya treatment, that is the strengthening of the digestive system. So if we strengthen the digestive system and the correct diet is taken by the patient, it then leads to good Ras Dhatu and good Artav, then it leads to correction of the PCOS. In the second image, that is in the bottom of the, you can please move the cursor to the second image. Yeah, you can see that the blue color is that it is a blue color, it is uterus. So in front of the uterus, there is a urinary bladder, and in the back side of the uterus, there is a rectum. So both the urinary bladder and the rectum affects the health of a uterus. If your urinary output is good, if your quality of urine is good, and if your quality of the stool is good, and they both act naturally and don't have any ailment, then the uterine health will be good forever, uterine and both ovarian health, and you will not suffer any kind of PCOS from that. The third treatment that we give in our Shri VISHVA treatment, that is Nasya. Nasya is the administration of medicine from nasal route. As we can see, the pituitary gland in our brain governs the ovary. So the Nasya does a kind of pituitary stimulation, which also can be used in the PCOS patient. Next, please.
All right, so let's come to the success story part. Dr. Rahul, would you want to narrate first and then introduce your client? Or how would you like to do that?
First, I will discuss my both the cases. The second case, client is present here, so she
Okay,
can go on with that.
all right.
There is a patient. The first patient I am presenting is was a 30-year female. She was a housewife. The diagnosis she was pre-diagnosed with PCOS, but her main concern was cosmetic. That is, she was suffering from acne, along with facial hair growth. She was also suffering from delayed menses, weight gain. Her cycle was coming with a gap of 40 days, and there was pain and clots during the menses. She was also suffering from painful intercourse and constipation. The ailment period of the patient was 4 years. The patient used hair removing products, but it didn't help at all. Even the patient gone for laser treatment, but due to severe complications in the skin, the patient left that laser treatment and started modern medicines for the PCOS that somehow regularized the cycle of the patient, but the weight gain and menstrual disturbance was seen soon after as she discontinued the treatment. So the patient approached me for a cosmetic point of view and with a safe treatment approach. Next, please. The diagnosis of the patient was made as Thalya and Vat Kapha Roga, and the causative factors were that the patient was not uh, having any kind of milk or cow's ghee in her diet. The patient has had a habit of excessive consumption of fast food and excessive use of deodorant. The deodorant generally blocks the pores, sweat glands pores, so it leads to the Meth Doshti. Third hetu was the patient was having late night sleep. So the correction of the during the treatment, the correction of the diet and sleep schedule of the patient were done. Patient was recommended with a brisk walk in the morning hours, and deodorant use was stopped. Internal medication like Arogyavardhini Vati, Sukumar Grit, or Tajadi Shilajatu were used in the first follow-up. Then we used Chandraprabhavati, Navayashlo, and Kalinga Kadi Yoga in the later stages. And we planned a 10 days Sacharaji Tel Matra Basti, that is medicated anemia to the patient. And then we advise the patient to repeat the ultrasound after the Basti Panchakarma. Actually, the patient, after starting the treatment, our menstrual cycle reduced to 30 days within a 1 month of initial treatment. The pain and clots were reduced during menses. Her acne was reduced, and in next 60 days, the reduction of facial hairs were there. Menses got even smoother. Her bowel movement become normal. And after the Sacharaji Tel Basti, that is after the Panchakarma procedure, the menses repeated within a 28 days gap. The 28 days is a benchmark for any menstrual cycle. After that, the Panchakarma treatment, her menses repeated with a 28 days gap, and uterine contraction and pain was gone completely. Acne scars were gone after the 90 days period, and during the treatment schedule, the patient lost 15 kgs of excessive weight, which she put on during PCOS treatments earlier. And we advise the patient to go for a USG, and the PCOS was gone, but since the USG showed cervical infection in the patient, and after history taking, it was ruled out that the cervical infection is due to a rough sexual session performed 2 days before the USG. And the current condition is that the patient, it's been a year, the patient has no recurrence and her menses still are getting regular, and patient is completely satisfied with the result. Even the patient sent her relative for the PCOS treatment too. Next, please. You can see the ultrasound reports of the patient.
Wow, This
You
is
can compare
amazing.
both the reports, and you can see that the patient was suffering from bilateral PCOS, and in the next, she was absolutely fine. Next, please. Now, there is a second case study. Yes, the patient is also here with us in our Zoom app. But first, I will tell them what the patient is. The patient was a 31-year-old female. She was a teacher, according to occupation, uh, and the diagnosis were primary infertility and PCOS. Actually, the patient was unable to conceive even after the 2 years of the marriage. Uh, Once her menses started, soon it got irregular menstrual cycle with this 45 to 90 days gap. That means the patient menstrual cycle was not regular from the onset of the menses, and the patient gained 10 kg weights after her marriage. So the ailment period of the patient was 14 years of irregular menses, and infertility, since she was married for 2 years, the infertility ailment period was 2 years. The treatment history of the patient now. Before marriage, she took on and off allopathic treatment since 14 years to regularize her menses. Hormonal medication prescribed by the doctor, some sort of improvement also observed, but weight gain and unnatural hair growth were there due to the side effect of these medications. After marriage, the patient took 10 months of modern treatment, including clomiphene, hormonal pills, but she was not conceived at all. Then doctor ultimately advised her to go for IVF. But the patient was unwilling because IVF is a big procedure. It is a very costly procedure. So patient approached me for Ayurvedic treatment of the PCOS. The diagnosis of the patient was Pandu and Dhatu Shatilya. Made Dushti, the patient positive factor that she was sleeping in the daytime. Second, she was having excessive intake of water, excessive intake of curd. She was having malbadhata, that is a constipation. It leads to the Vata Dosha, and she was also having some mansik hetu, that is psychological issues, because the patient was a teacher. Whatever occupation you are in, because in some occupations like doctor, teacher, or lawyer, there is excessive use of brain. So these patients easily get stress and mental exhaustion. So the treatment started, patient's treatment started. Again, we corrected her diet, advised her to go for yoga and pranayam along with that. We used internal medications like Falsarpi, Raspachak Vat, Shiva Gulika, each with 15 days follow-up. Then we changed the medication and added Kubirakshvati instead of Raspachak in the next follow-up with the Dashmula and Tapyadilo. The patient treatment, this medication continued for 2 months. We planned the patient for the Virechan Panchakarma because the case was of Medavrut Vat. Virechan means that medication, medicinal purgation. But before planning, patient got conceived. Next, please. The weight of the patient was reduced within initial 15 days. Patient felt energetic. Her craving towards excessive sour items like curd, tomato, etc. were reduced. The gap of the menses reduced to 35 days in first month. The consistency of menstrual blood improved of the patient from the menstrual blood. The color changed from black to red. And then later it took almost 3 months to reduce that menses from 35 days to 30 days. Patient got conceived on the 4th month of the treatment without the Panchakarma procedure, and patient continued the treatment. We also give treatment to the pregnant females to strengthen her uterus, to strengthen her child. And the patient, since the patient got conceived with our treatment, she was convinced to move forward with the treatment. and we continued the treatment for 9 months. The treatment was Garbha Sanskar treatment this time, and due to that, the whole 9 months of the pregnancy of the patient passed smoothly, and patient delivered a healthy male baby normally of 3 kg weight, and his Abgar score was 9. It is a Abgar score is a criteria of wellness of a baby. The 10 is the uppermost range, and the Abgar score of the baby was 9. So how brilliantly the Ayurvedic treatment help in such kind of patients. You can see the reports of the patient. Left one is the when she came to me for the treatment, and the right one is the USG of pregnancy. You can see that. Now the patient is connected with us. She can share her experiences of the treatment.
Monica, would you like to share your experience? We'd like to introduce you. All right. So we have a case number 2 client with us, joining us live. So if you can just speak for 1 minute or 2 minutes, that's it. Just to assure other women that would help, that the treatment really helps you. So that's what we really want other women to listen to your story in a very brief 1 minute or 2 minutes. You're on mute, Monica. Can you unmute yourself, please? You are still on mute. We cannot hear you. Okay, we cannot hear you. In the meantime, we are open for questions. We are open for questions until Monica can unmute herself and start say something. I don't know why we are not able to hear you, Monica. Can you hear her, Dr. Rahul?
No, actually, I can also hear her.
Yeah, no, she's not on mute. I don't know why it's somehow.
The screen is showing unmute, but we are unable to hear. Can we?
Yes. So we are open for questions. Why don't we open up for questions until Monica can talk? So what we want to say is that, oh, maybe Monica can talk. Let's just wait for 1 second. Monica, can you say something?
Yeah, hi, can you hear me?
Yes, now we can hear you. So if you could talk for a minute or so about how Ayurveda therapy helped you with all the symptoms that you had, it would I think give a lot of stuff. Yes, thank you.
Yeah, thank you so much for inviting. It had been a great pleasure, basically having a treatment from Dr. Rahul, because it's a basic when we try for for our pregnancy. During that time, we go through a mental stress throughout the time. But if you have a good treatment and you have a line of actions to be involved in the same. So Dr. Rahul has helped me throughout the time, especially when I was going through a lot of mental stress at this concerning my medications and sorry. Can you hear me?
Yeah.
Yes, we can hear you.
Yeah, so initially it was related to my the treatment was allopathic, and later down the line it resulted into, because the doctor has recommended me for the IVF treatment, and I wasn't able to go for the IVF because it was quite costly. So later, when I met Dr. Rahul, he recommended me such a line of treatment that within 4 months of period, I got pregnant. And, it had helped me in such a way that ultimately it resulted into a lot of less stress. And ultimately, I was pregnant with a baby, healthy baby at the end of it. So it has been a good experience for me, and I will definitely recommend for these kind of natural procedures, which not only helps in boosting your immunity and giving you a positive results, as well as he had been a great support throughout as a mental mentor as well, you know.
Thank you. Thank you. And you would highly recommend Ayurveda treatment to other women or even girls. They might not be trying to get pregnant, but also Pcos, which is very safe, right? And in your
Yeah, definitely, because it's a natural therapy. So it includes a lot of, rather than going with the allopathy treatment, I will definitely recommend the natural side of it, so that they can have a healthy pregnancy, and they can, they can have a healthy baby at the end, which is the most priority thing for anybody, you know.
Sure.
Yeah.
Okay, we are open for questions. If anyone has questions for Dr. Rahul or even for Monica, we are open for questions. So please write your questions in the chat window. Okay, so someone is asking on completely different topic on Sunday. Yes, we can take that. We want the questions relative that are relevant to PCOS. Someone is asking, where does the doctor practice? He practices out of India. And if you want to consult, I have written our email address over there at the top, care@nourishtalk.com. You're welcome to reach out, and then you can consult with Dr. Rahul for any of the issues. Okay. Any other questions from the audience? This is all anonymous. You're welcome to ask questions. It's not going to be, you can ask the questions anytime. There is absolutely no issue. And what we are going to do is we are also going to do a group workshop, and that will not be on FB Live or anything. You can go in and ask any questions from Dr. Rahul. We will be bringing the group workshops in October. A lot of workshops will be coming at that time. But right now, if you have any questions, okay. So someone is asking, I live in Delhi, India. How can I get Panchakarma therapy if Dr. Rahul suggests any? Well, I think, the first thing would be you talk to Rahul, Dr. Rahul first, and then write Dr. Rahul, and then he can suggest any of the good partners in Delhi, India.
Actually, the Panchakarma is a supportive therapy. The medicinal treatment is a key treatment for PCOS. So first you have to go for a medicinal treatment, then you can go for a Panchakarma procedure along with that. Then it will be a better treatment result-wise. So you can consult us for the treatment, and we can surely recommend you the Panchakarma treatment if willing in your nearby place in Delhi.
But the first step would be a consultation, and that you can do online. And can you clarify that, Dr. Rahul, for everyone who's listening?
Yeah, but if you are from India, you can consult us through nourishtalk.com, or you can also consult with our website. And after the consultation, the detailed history of the patient has been taken, and from that we prepare a customized treatment package for the patient, and we ship it to the patient as per his or her address. So it's easy if you consult us directly.
Sure. Well, we can, I have put down our email address, care@nourishtalk.com, and our website is also there. So you can send us an email, and then we'll connect you to Dr. Rahul. And then if you're in India, we'll connect you directly, and then you can consult with him directly. That's not a problem. Any other comments or questions? Okay, so there is a question saying, please advise a line of treatment for bulky uterus with endometrial hyperplasia.
Hello, is my voice clear?
Yeah.
Hello.
Were you able to hear what I said, Dr. Rahul?
Yeah.
Line line of treatment for bulky uterus with endometrial hyperplasia.
Okay, since the uterus is formed from Rakt and Kapha Dhatu, the bulky uterus comes in the category of Dhatu Shaithilya in Ayurveda. First of all, the patient Rakt Dhatu, that is blood, needs to be improved. The quality of blood needs to be improved in that such kind of patients. And later on, once the quality has improved, the patient needs to undergo a variation treatment for that. And after that, once the tone of the uterus becomes normal, the recurrence of the condition can be avoided.
Okay. Someone is a B.A.M.S graduate from Mumbai, interested to learn more about gynecology, Pcos, Ayurveda. Can you suggest me someone? We will be doing workshops for from Dr. Rahul to other experts as well. So, so you can learn from our platform. We will be releasing some expert to expert learnings as well in October. So we can let you know, since you were already signed in through Zoom. Okay, so can you tell us about the consultation fee or treatment cost? I think you can just email us, and then we can. I think it depends on patient to patient. Right? So we don't want to start quoting, these are educational webinars right now. We're trying to educate as many users as we can through that efficacy of natural therapies. Okay, so the other one is in Pcos, irregular menses is key feature, how we can manage heavy bleeding cases in Pcos. Are you one of the doctors or are you the patient or client? I'm asking this person who's asking the question. Okay. This webinar is for the end client. If you could, end client can ask the questions, we would appreciate that. If you wanted to learn more about how you want to manage your clients with heavy bleeding, I suggest that you attend one of our group workshops, which would be for the expert to expert. Any questions from the client itself? Okay. All right. Any, well, if you can't think of any questions, like I said earlier, you can email us, and and it's all anonymous, it's confidential, so don't worry about that. With that, any final comments from you, Monica, or Dr. Rahul, before I wrap up?
It was definitely a great line of treatment from Dr. Rahul, and I'll definitely recommend each and every one to go with the natural therapy, because during the phase of pregnancy, you definitely want a positive results, and with no side effects. And allopathy definitely bring a lot of side effects in that. So I will definitely highly recommend for that.
Okay.
Thank you so much.
Thank you. There is a question, Dr. Rahul, before you say your final words. Someone is, they're living abroad. And where are you living? I'm not going to say your name, but let us know where you're living. There's no problem. Like I told you earlier, you can contact Dr. Rahul through our website. Send us an email, care@nourishtalk.com. We are based in California, US. So you can definitely, yes, we are also a US-based company. We are in California. So you can send us an email, and we will connect you with Dr. Rahul for the consultation. All right, so there's no issue at all. So I've written our email here. Okay, any other comments before okay, thank you. So please give us the feedback on our sessions. We really appreciate that. I'm going to wrap up the session now. I just want to make sure that if there are any other questions, we can take one more question. Okay, I don't see that. That's fine. Well, thank you so much, Dr. Rahul, for being with us. Any final comments before I wrap up?
Yeah, I want to say this confidently from the platform of nourish.com. That PCOS can be effectively cured with Ayurvedic treatment safely within 3 to 5 months. So if you are suffering from PCOS and you are also suffering from the side effects of the modern treatment, you can contact us for the treatment point of view. And there is not the rocket science behind it. Just you have to start the medications, follow the basic rules, and you will be better. and you can pass on the knowledge to your, as I said, to your upcoming progeny or upcoming generations too.
Thank you so much for being with us, Dr. Rahul and Monica. I hope the session was useful for all the attendees. Please help us spread the word, help us share our sessions so that more people can start using natural therapy with effectiveness. With that, thank you so much and signing off now.
Thank you.